Hey everybody, it's Dr. Henstrom here from Utah Facial Plastics. I hope everybody is staying healthy and disease-free out there. I know this is certainly a weird time for all of us, but we're getting lots of calls and questions about a very common procedure that we perform. And this is a common time of the year for people to be looking into getting an otoplasty, otherwise known as an ear pinning surgery, done either for themselves or maybe for a child of theirs. So I just wanted to tell you a little bit more about that procedure and what you can expect. First of all, we don't typically do an otoplasty procedure on anybody younger than at least 6. You've got to get to about 6 years of age to get most of the adult size of the ear is done by then. Now, children, when we do otoplasties, we will typically take them to the operating room because it's just difficult to get them numb and comfortable. So those are best done in the operating room. But most adults, we will do this procedure in. Usually when people are seeking to have an ear pinning or otoplasty procedure, it's because their ears stick out too far. There's a couple of major things that will cause that in most people. One, when you're born, maybe this fold called your antihelix didn't fold and it's flat, which means the tip of the ear really protrudes far. The other thing is that this cartilage that creates the bowl or the concha of the ear is too protuberant and it pushes your ear away from your head. Usually at least one, if not both of those things needs to be fixed. The way that we do that is all through the back side of the ear. Incision on the back side of the ear so it hides very well. And then we'll use permanent sutures on the back side of the cartilage of the ear so that when we tie those sutures, it forms this fold. Or when we tie the suture, it brings the ear in closer to the head, depending on where we put it and how we suture that in. Once the ear has been pinned back with those permanent sutures that are underneath the skin, we then close the incision. When we're done with both sides, you're going to get some gauze on your ears with a wrap around your head. That stays on for about 24 hours. You take that off at home, and then we have you continue to wear this soft Velcro strapped headband on your ears to help keep them in, take pressure off those internal sutures and let it heal. You come back a week later and we'll remove the stitches. Even before then, you'll see the difference that your ears have undergone. And for the majority of patients, it's a very satisfying surgery, especially when, quite frankly, they've been carrying a burden or maybe they were teased when they were young and they've hidden their ears in one way or another. They've worn hats or they wear their hair long. And hopefully we can get you comfortable enough to wear your hair pulled back or maybe put that hat on that you wouldn't have otherwise, or take the hat off that you otherwise wouldn't. In conclusion, otoplasty surgery or ear pinning surgery is one of the more common procedures that we perform. We love doing them. We'd be happy to see you or talk with you more about it at any time. If you have any questions, if you want to come see us in the office, we hope to be open sometime soon, or we can do an online virtual consultation. Feel free to give us a call at 801-776-2220. You can also visit our website at utahfacialplastics.com and see some of the before and afters that we have there. Thanks a lot and stay healthy.